into my eyes and show.
Hi guys, this is Caroline Peregrino, Psychiatric Nurse Practitioner out of California. Today what I want to talk about is the ugly truth about being a Psychiatric Nurse Practitioner. I think having an experience for about 5 years in this role, I have been able to list what those are, and that's what we're going to talk about today. And what you're going to get out of this is 3 things. One, you're going to identify what's the real life challenge of being a Psych NP, and it's not all fancy and dandy. Number 2, you will know that you are not alone in this experience when you do experience it. And number 3, I want to teach you how you can overcome these challenges. So make sure that you stay tuned. For those of you who are new to this channel is about my own experience, the struggles, the good, the bad, the ugly, and I want to be able to impart that experience with you so you can be empowered to be the best psychiatric nurse practitioner that you can be during this journey. Okay, so if that's something that you want, please do subscribe to the channel, like, and also hit the bell button so that you can be alerted when there is a new video that comes up. Okay, so let's begin. What are the ugly truth about being a psychiatric nurse practitioner? So like what I said, it's not all fancy and dandy and nice, but there are definitely a lot of challenges that I have experienced and still experiencing as a psychiatric nurse practitioner. One of them is, there's going to be 5, and one of them is the comparison between an MD and an NP. I do not think this is just for psychiatric NP, but NP in general. The general population do not understand what's the difference between MD and NP. There may be some people, maybe there's a lot more now compared to 10 years ago who understand it, but there's still that, inadequate knowledge about the difference between an MD and an NP. And I am usually called doctor, and I have to correct them sometimes and let them know that I do not have an MD degree. So this sometimes, because of this comparison, kind of influence us to have imposter syndrome, to have low belief in our abilities, because of that general belief that the MDs have more knowledge and more skills and are better providers than us. I think that what's really important is that during your first few years, and even as you continue this journey of being a nurse practitioner, one, you really need to educate the people you're around, your colleague MDs, your colleague RNs, the patients, about what your role is and what's the difference between the two profession. Number 2 is you want to really empower yourself to believe in yourself. And I'm gonna post the link here about how to overcome imposter syndrome, because that's really an important and essential way to manage this challenge, the comparison between MDs and NPs. Number 2, there are those in the medical community who has very limited knowledge or limited belief, trust, or respect towards NPs. I think one thing that perpetuates that would be states that do not allow NPs to have full practice authority, and California is one of them. So there is some disrespect that happens. I fortunately have not experienced that, but I have heard of it from other colleagues, from psychiatrists who do not respect NPs or do not trust NPs' judgment on certain patient condition and treatment, or other medical communities, like could be PCP or other fields of practices. And I think again it comes with educating, so that you can prove yourself and gain that respect from other specialty communities. Number 3, as a field in general, psychiatry has a very limited resources in terms of treatment in comparison with the medical community. If you think about it, bacterial infection, there's sensitivity, culture insensitivity. We know exactly what medication, what antibiotic would work for a certain infection. In psychiatry, we don't even have a blood test to know whether you really have depression. We use the big book, the DSM-5 to, identify symptoms that you have based on the subjective reports of the patient, in addition to our mental status exam and our own evaluation of the current condition, and then come up with a treatment plan. Unfortunately, it's not clear-cut. It's still not an exact science. It's still very much an art form. We cannot say that one antidepressant would work for a certain condition, even though this patient has the same condition as the other person who really did well on, say, Zoloft, may not be the same for this person. So it's still a science. So it's not clear cut. So that is a big challenge because we're limited by those resources and research that we currently have. Although, compared to 10, 15 years ago, we're getting better. There's genetic testing for medications, antidepressant, ADHD, pain management, mood stabilizer, antipsychotic, which is a very good, I think, advancement in psychiatry. So there's things that's happening, but we're still completely far away from where the medical community is now. So one thing to do is, again, make sure that you improve your knowledge, make sure you're updated with information that's available, the evidences, the researches that's available in terms of psychiatric treatment. So number 4, benzodiazepines. They are the bane of our existence. I think I say that because I'm sure a lot of psychiatric nurse practitioner, current psych NPs, new grad psych NPs are very anxious when it comes to prescribing or continuing, or patients asking them about benzodiazepine, just because we know of the risk. I think back when I first started as a psych NP, I was very anxious when patients come to me on high dose of Xanax and had been doing it for 15 something years, since the 90s, and I cannot blame them, because back in the 90s, because it's marketed as one of the best medication, and there hasn't been any research that we have now that time of the risk, so it was given almost like candy. So a lot of these patients are dependent on it, may not be necessarily addicted or misusing it, but they're physically dependent because of how long they have used the medication. And I think that is something that really causes anxiety for us new nurse practitioners, because we know of the risk. So what I have learned is, again, to talk with the patient about what's the difference in treatment modality before 10, 15 years ago, and treatment modality with the use of benzodiazepines now. And when I explain to them the risk, most of them do respond really well, and they say, I did not know that. So I think the more that you educate your patient and give them those reasons as to why you would rather have them go down or taper off and switch to something else that could potentially be safer, most of them are pretty receptive to that. And so I think one way is to take out that physical anxiety, but be more neutral about it, because I do remember having that physical anxiety when benzodiazepine is mentioned during a visit with a patient. And so now I have learned to remove that and identify that, yes, it does make me anxious, but I have to meet the patient where they are and tell them about the potential risk and what is it that you can do to help them get off of it, or if that is even the plan, or to help them be monitored closely while they're on a high dose benzodiazepines or benzodiazepines in general. I think it's something that maybe I would want to talk about in a different video, because it's really, really important. So that's number 4. And how about number 5? Our pay structure sucks. Nurse practitioners in general are not paid well. And I think there's a lot of factors. One is Again, it comes from the general community not knowing and understanding what roles we have. The respect that we need is not given. And also, I mean, I think there are a lot of NPs who have just accepted this pay structure because they think that's the going rate. And I also have a video about going rate that I would really encourage you to see if you haven't, because if we just keep accepting what's the going rate is, especially if it's a private practice and not a hospital or a big organization, then you're probably losing out on a lot of things, and you're also allowing the next NPs to accept the same, because these companies will say that is the going rate. So we could do better, and I hope we do it one NP at a time, and to not allow others to degrade your value as a provider. Okay, so those are the 5 challenges that psychiatric nurse practitioners face in the real world, and I hope that you're able to understand how you can improve your abilities to face these challenges. And if you have learned something out of this video, please like this video and subscribe to this channel and hit the bell button so that you can get more videos in the next few weeks or in the next months to help you improve your skills and better yourself as a psychiatric nurse practitioner. So with that, I want to thank you for listening to me for about 10 minutes, and take care, guys. Bye.